And in his work, he integrates basic and clinical neuroscience to study traumatic brain injury, socioeconomic disparities in clinical outcomes after spine surgeries, and related to today's research, the effect of COVID-19 on the nervous system. And his talk today is looking at COVID-19 and the nervous system, the role of inflammation and the blood-brain barrier. And I'll let you take it away, Mark. Thank you.
That's excellent. Thank you very much for the kind introduction. So you're seeing my slides okay? Hearing me okay? See my mouse?
Looks great. Yeah.
Perfect. Perfect. Okay. So very excited to give a talk and grateful for the opportunity to speak tonight. I'm going to be presenting a review article that I completed and hopefully provide a unique perspective on coronavirus disease and some of the symptoms that we're seeing in patients, specifically with a focus on those that are neurological. I apologize if there's any sounds of rain or thunder in the background as it's quite noisy outside at the moment. This is a hypothesis generating review, so hopefully this will promote some discussion. A little background, coronaviruses are envelope viruses that can infect animals and humans. And the SARS viruses cause severe lung disease, and that stands for severe acute respiratory distress syndrome. The first SARS-CoV-1 was discovered in 2002, and more recently, as we're all familiar with now, and perhaps a bit tired of, COVID-19, which is caused by SARS-CoV-2. That was discovered in 2019 in Wuhan, China. So severe coronaviruses can cause severe lung disease, and this is primarily mediated by disease of the small blood vessels in the lungs. Particularly, patients experience severe inflammation, which can lead to failure of breathing, and this manifests as what's called an acute respiratory distress syndrome. There are a number of risk factors which have been identified for severe disease, including old age, as well as medical diseases such as diseases with the blood vessels in the brain, diabetes and high blood pressure, as well as problems with the immune system. As of 2019 and 2020, a number of papers were published documenting neurological symptoms and signs. So those are what patients report and what we observe in patients, respectively. And some of these studies were published in reputable journals, including The Lancet, Nature, Cell, and others. So as these were being published, I thought to myself, this is quite interesting. I'd like to do an informal review of the literature, a narrative review, and see if we could kind of decipher some of the neurological symptoms and signs patients are experiencing, as well as perhaps generate some hypotheses to try and explain why are we seeing these neurological symptoms, especially with the potential for possibility that this virus might infect the nervous system. So searched a variety of different terms, as well as a number of different scientific databases. One of the first studies that was published documenting neurological symptoms in this patient group was published actually on the original cohort of patients where the virus was discovered in Wuhan, China. And among that cohort, neurological symptoms were found in a quarter of patients, which is quite high. A number of risk factors for those symptoms were discovered, including severe infection, older age, and medical comorbidities. You might recognize those are the same ones I mentioned are risk factors for severe lung disease. The list of different neurological manifestations is quite long. And since the original Wuhan cohort, we found the incidence of neurological involvement is actually quite high, up to 84% of patients in case series. So some of the symptoms and signs that patients are experiencing include cerebrovascular disease, so disease of the blood vessels like stroke or lack of blood flow to the brain, encephalopathy, which is a catch-all term for generalized brain dysfunction, seizures or epilepsy, as well as changes in smell and taste. With regards to seizures, there are some recent studies which have been published that show that of patients that are infected with COVID-19 that have neurological symptoms, some series are documenting up to 40% of patients are having changes identified on their brainwave studies that would indicate seizure-like activity. And stroke is also generally, overall, the incidence of stroke is low, but relatively speaking, compared to influenza, the incidence is 8 times higher among patients with COVID infection. And we're seeing it in young patients as well. We're also seeing changes on brain imaging. So we're seeing signs of brain inflammation, signs of degeneration of the nervous tissue, and we're also seeing lack of blood flow or stroke. So with all of these in mind, one of the theories that I put forth was that potentially SARS-CoV-2 might actually invade and infect the nervous system. It's been known since early 2000s that human respiratory coronaviruses are capable of infecting neurons. So they demonstrate what's called neurotropism. This just means that they have the potential to infect neurons. And the top study in the top left there, that was a mouse study. The authors actually inoculated mice with with a human coronavirus and demonstrated it was capable of infecting and getting into the brain and causing inflammation. And the study in the top right is one of SARS-CoV-2 actually, so coronavirus disease 19. And this was published in the New England Journal of Medicine in 2020, where the virus was actually detected in the brain on autopsy. So how might it be getting, the virus might be getting into the brain? I put forth a number of different proposed mechanisms, but I'm just going to quickly highlight two tonight. One of them is via accessing the brain via the nerves. So this could potentially be there are two main nerves that we propose this could potentially be occurring by. So one is the olfactory nerve, and this is a nerve at the base of the brain at the top of the nasal passage. So you can see that in the top left here. So the virus is inhaled through the nose and they could infect that nerve and get into the brain. The other would be potentially thought via the vagus nerve. This is a long nerve that innervates the lungs as well as the gut and sends its passageways back to the brain. And infection through these nerves has been demonstrated with prior coronaviruses, and it's been shown that the virus can indeed, and this is not SARS-CoV-2, but prior coronaviruses. So there is a mechanism by which they could potentially access the nervous system. And thankfully, we have an innate defense system that protects against this. That's why everyone with infection doesn't develop brain problems, so to speak. If we're thinking about just the olfactory nerve, there are a couple of studies that we came across, animal studies that did show infection of that nerve. The virus could infect that nerve and get into the brain. And that may indeed explain some of the loss of smell and taste we're seeing. The other is, I mentioned, via the vagus nerve, and that's the one that sends its passageways to the lungs and to the gut. And it's been shown for influenza, as well as some Rio and enteroviruses, that after the virus is inhaled in the lungs, it can indeed infect the vagus nerve and get back to the brain. Again, this has not been shown for SARS-CoV-2. This is for other viruses. The next mechanism was potentially by accessing the bloodstream. So inhale the virus, it infects the blood cells, the immune cells, and then those can be transported to the brain by the blood. And I have here the BBB. This is the blood-brain barrier. So it's what separates the blood from the brain, literally. So why might this be possible? The receptor that the virus binds is called ACE2, and this has actually been found in both nervous tissue and in the blood vessels in the brain. More recently, it's been shown that SARS-CoV-2 can indeed infect the blood vessels in the brain. So here's a picture that I put together of the blood-brain barrier, and this is the healthy blood-brain barrier. Here you can see that this is the blood vessel in cross-section, and this are endothelial cells lining the blood vessel. There are some supporting cells, and these are the brain cells here, the neurons and the astrocytes. Together, these form the building blocks of the blood-brain barrier and are referred to as the neurovascular unit. Again, this is a healthy picture. The ACE2 receptors that the virus binds are found on these cells here. So this is a bit of a busy picture, so I'll go through it slowly and try and cover it in lay term. What we're proposing happens is that the virus gets in through the lungs, it affects the immune cells, and then they get transported up into the blood vessels of the brain, and then they can squeeze through the blood-brain barrier and get into the brain, either between or through cells. In the presence of infection, the ability to cross the blood-brain barrier is increased because of the inflammation that those viruses cause. So the second theory that I put forth is that, generally speaking, you can get inflammation from these infected immune cells. That can lead to a leaky blood-brain barrier. Potentially, the virus could get into the brain this way, and then brain inflammation can ensue. And this could potentially explain the neurological symptoms. The third theory is that leaky blood-brain barrier is known to cause an increase in certain neurotransmitters, as well as electrolytes that can cause seizures. So this is just another example where you might have a neurological symptom that develops, and that is actually known to even worsen blood-brain barrier dysfunction. So a pathological loop, so to speak. So what might we do about this, or be able to do to detect this? So Dr. Friedman, whom I'm doing some research with right now, has shown or developed a technique actually to image the brain. And these are pictures of the brain using brain imaging or MRI. And here are some pictures of a healthy brain. And here's one with a leaky blood-brain barrier. The problem with using this as a screening tool to see who might develop neurological symptoms is that it's costly and it's time intensive. Another surrogate might be actually to image the blood vessels in the back of the eye. This has been shown that when there's leaky blood vessels in the back of the eye, it's a surrogate for leaky blood vessels in the brain. So generally speaking, tonight I've just put forth a couple of hypotheses, and that's really been the goal of this project. The hypotheses are that these coronaviruses might invade the nervous system, and that a leaky blood-brain barrier in the setting of inflammation might actually further promote passage of the virus into the brain. The passage of the virus into the brain might explain some of the symptoms that we're seeing. So that's everything for tonight, for me anyway. I'm happy to answer questions if there's time. And thanks to Dr. Friedman for his support, and Dr. Kaminsky, who is a postdoctoral fellow with whom I conducted this review. Thanks.